Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 49 new cases of COVID-19 in Windsor and Essex County. Of the 49 cases, 33 are outbreak related, 2 are close contacts of confirmed cases, 5 are community acquired, and 9 are still being investigated. We have had 12,865 cases since March of 2020. 12,221 cases are now resolved, and 268 people are active at this time. 42 confirmed cases are currently in the hospital, and 5 people are in ICU. Our community has lost 376 people to COVID, with 236 deaths occurring among residents, staff in long-term care and retirement homes. There are currently 12 active outbreaks in Windsor and Essex County, 4 in long-term care and retirement homes, 2 community outbreaks, 4 workplace outbreaks, and 2 hospital outbreaks. We are currently in phase 1 of Ontario's 3-phase COVID-19 vaccine distribution plan. 11,501 individuals from Windsor-Essex County have now received both doses of the COVID vaccine. We encourage residents to visit our newly updated vaccine webpage for further information. The new webpage can be accessed directly at wechu.org/cv/vaccine or by visiting our wechu.org homepage and clicking the COVID-19 vaccine button. Despite the beginning of the vaccine rollout, please continue to follow public health measures. Stay home if you're sick. Limit your close contacts to your household members only. Maintain a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering, and cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us today. As we continue to manage the COVID pandemic, we are also rolling out the vaccines in the region. The next group of vaccination include those from the early priority, as well as the newly identified priority among the healthcare workers that belong to the very high priority group, and the seniors 80 plus in the region. As our team finalizes the plans and ensure that everything is well aligned from a legislative responsibility and the local infrastructure to support the next group to get the vaccine. I want to remind everyone that vaccine rollout in our region is still slow, and individuals in each of these priority groups will have to be patient with us to get vaccinated. For those who are vaccinated, please note that you must follow the same public health measures even after receiving the vaccine. Getting the vaccine does not allow you to stop taking public health measures. Public health measures will be in place, and everyone, whether vaccinated or not, must follow the public health measures. Thank you.
We'll now take questions from the media. Today we'll be starting with Blackburn.
Hi, good morning, Dr. Ahmed. I have a question from actually a listener who wanted to know, well, a little bit of background. This is a person who has a son with a disability who is cared at home by 8 healthcare workers that are basically contracted by the family. They wanted to know if they can apply as an organization to get those healthcare workers inoculated, or if those healthcare workers do it on their own. I know you set up a website for them to register.
So at this time, it's the healthcare workers who will be getting the vaccine, and those healthcare workers that are not affiliated and working independently will have to look at that group in particular, and we'll have to make sure that we have enough checks and balances in place to ensure that those are the actual people who are working, rather than anyone who just think that I am providing the care and I need the vaccine. So I think those are the things that we have to sift through, and our media release does identify the healthcare workers belonging to each of these categories to apply for consideration, and then the team will look at their eligibility and will make some of those decisions at that time. If it's an individual, we'll have to take it back, and we'll have to figure out a way to make sure that we're following the process accurately and ensuring that the vaccine is going to the right people.
So to clarify, they should apply through the registration website and then they'll get consideration once they're, I guess, investigated, sort of?
Yes, that would be the easy answer, yes.
The other question they have is when will the disabled get the shot that are not living in congregate settings?
So those individuals, if they are receiving any chronic home care, would be classified under the adults in the chronic home care, recipients of chronic home care. We've been working with the Ontario Health Community and Home and Community Care to have a list of all those individuals and to start prioritizing them for the vaccine. So they are also included in the next phase of the priority. As soon as we have gone through the current priorities, those will be included in the next set of priorities. I think that would come in when we have more vaccines.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. What outbreak are all of these outbreak-related cases coming from? Is it multiple or is it limited to mostly one sector or organization?
So we continue to see some cases that are still showing up in some of the existing outbreaks, and most of the cases that we are seeing is the newly identified outbreaks, mainly in the shelter population, and that's what we are trying to make sure that these individuals are appropriately isolated and preventing any further spread in that population. There's a lot of work that was happening with the city, with the health sector partners to work with that population, recognizing that all of these individuals that we are talking about are not as simple and straightforward as we see in other population, and also their ability to find isolation sites to house them. So, but that's where we are right now. We're seeing new cases, and there's a lot of work that's been happening to provide additional support to this group.
Can you say if all of the 33 are related to that population or some coming from other outbreaks?
I have to look at the breakdown of that particular group. I don't think there will be 33 are linked directly to it. We know that we have done some additional testing at both Salvation Army and the Downtown Mission. I'll have to look at the actual breakdown. This is just a summary that we provide in the morning, and then our team will work through the list to further clarify who belongs where, and then the next steps based on that.
With such a large outbreak among a specific group of people, do you expect hospitalizations to go up? I know that at one point, I think we had as low as 33 people in hospital with COVID-19.
Well, so far, we haven't seen a lot of these cases going to the hospital, which is a good sign, but we don't know what it would mean. There are other reasons for some of these individuals to go to the hospital, either for a mental health reason or some kind of an addiction reason. COVID-related reason, I am not particularly aware that because of COVID that they ended up in the hospital system, but I agree with you. This is a large outbreak, and we have taken some of the steps as we shared that we have issued a Section 29(2) order to put further restrictions in terms of controlling the outbreak, and we are working with all our partners to find the best solution to support the population, and also adding some additional resources in the system to deal with with all these individuals who are struggling right now.
Thank you.
Any questions from AM 800?
Dr. Alma, just in regards to the 80 plus for the vaccination, the plan has not been revealed yet, has it?
No, we have not. As I mentioned, and maybe Teresa can add some additional information. There are certain logistical things that we need to make sure that is in place. We don't want to provide an information to the community and then go back and change it. So we are working through all of those details, and I'll let Teresa maybe explain a little bit further.
We hope to have more complete plans tomorrow. We're working on a few things, and before we announce it, we wanted to be absolutely sure everything was going to run smoothly. So I think tomorrow's YouTube session will be we'll have more complete information and be able to move forward with this group. So there is a plan in place for those that are 80 and older, and tomorrow we'll be moving forward with more complete details.
Okay, just wanted to make sure, I don't know if I missed that. And then a question for Teresa. Teresa, just in regards to individuals that have received both doses of the vaccine, has any of those individuals got COVID after receiving the both doses?
Not that we're aware of. We are tracking when people are being followed up and they are COVID positive, we are tracking whether they've been vaccinated or not, but following both doses, not that that has been, I'm not aware of that at all at this time.
Okay, thank you.
Any questions from CTV?
Yes, good morning. I know you haven't revealed the details yet of the plan for the 80+ population, but I know that some residents are concerned about being able to travel to the vaccination locations. Is that one of the things being considered, how to vaccinate those people?
So right now, the plan will not be inclusive of people that are having difficulty, mobilizing to the site. So it will be at a site initially. We have very limited vaccine at this time. So we want to just move it forward, and so it really will be those seniors that are able to attend a site. We are working on other plans to support people that are in their homes or residences. At this time, because of the limitations with the transportation of the vaccine and the inability to do that safely, we're not able to do that, but it is in our plans to make sure that everyone that wants the vaccine is able to get the vaccine, not necessarily through a scheduled clinic that we are planning for the people over 80, where they would attend on site at a defined location.
And what about the possibility of mobile or pop-up clinics?
Yes, so that is essentially what we're doing with the over 80 group because of the limitations with the vaccine, and we'll be probably doing less than 200 people a day, and it won't be as big as the general public when they're able to go and get the vaccine. This will be very targeted and scheduled, as will the other one, but I mean this will be very targeted. We have had discussions about going into other areas where seniors live, and right now that isn't one of the that isn't the first rollout for the seniors, but pop-up, as you say, are options for us as well. So we do want to go to where the seniors are, but also we know there are a lot of mobile seniors in our community that would be able to attend a site. And we're just working on all of those logistics. Not everything will be answered for tomorrow, but we do recognize that there are people that live in seniors settings that are outside of long-term care and retirement homes, and we want to be able to reach out to them and vaccinate on site when possible and when all the supports are in place. So working on many different pieces right now.
Okay, thank you.
Any questions from CBC?
Hi, good morning. My question today is for Teresa. I'm wondering about the health unit's budget and what impact the pandemic has had on the health unit's finances this year and last. Are there any kind of challenges that you see there that you can speak to today?
So we are bringing our budget to our board. It was supposed to be tomorrow, but it's actually been deferred for another week. And in the budget, which I won't really speak to everything, but in the budget, we have our cost shared programming, which is our typical budget. In addition, we have two other budgets that we're tracking, and one is for COVID expenses related to case and contact management, and the other one is COVID expenses related to the vaccine rollout. So I would say that our cost shared budget, that is, 30%, a 70-30 split between the municipalities and the province. That budget is, we'll be outlining that to our board, and I think we're on track with that budget. The COVID expenses, we know will be significant for our area. We did receive about $2 million prior for COVID expenses regarding case and contact management through the province, and we will be submitting, more in our budget. It hasn't gone to our board yet, so I hate to, say any more details than that, but it is significant, and we are tracking everything and making sure we align with what is considered an extraordinary COVID expense. So anything that we are able to work within our existing budget, we are. Anything over and above gets declared as a COVID extraordinary expense and submitted to the province. So we'll have more information. Forget exactly the date of the board meeting, but it is a special board meeting to talk specifically about the budget for 2021.
Thank you.
Any additional questions from Blackburn?
I just wanted to get you to reiterate the number of people who have been vaccinated fully. I just missed that number, that's all.
11,501 today.
Thank you.
Any additional questions from the Windsor Star?
You may not have this number in front of you, but do you know how many cases are now associated with the shelter population?
Up until yesterday, we had 70 cases from the mission, and sorry, hold on. Yeah, we had 70 cases that are linked to the mission, and we had seen some cases increase in the Salvation Army as well. And as I said, with the additional cases, we'll have to put that number in, and we may share more. I'll see Taylor if we can send that information later today with the most up-to-date counts.
Okay. Thank you.
Any additional questions from AM 800?
Dr. Ahmed, just in regards to that, has the health unit, I know you mentioned earlier this week working with different community partners, the city, has the health unit reached out to, for example, Street Help on Wyandotte? Are you in conversations with them as well?
So some of these crisis response is happening with the IMS table that is operated by our EMS chief, Bruce Crowder. And it includes many of the health system partners locally. So we are working with the IMS table to go into the, further tapping into the additional resources. But I know the team that are providing that on-site support also includes the Hotel du Gris Healthcare and Windsor Regional Hospital and many other players who generally work with this population group. I'm not entirely sure that if CHC is directly involved, the Street Health is directly involved at this time or not, but they are also part of that group. And
I think he's talking about Street Help on Wyandotte.
Oh, so this is different than the CHC. Okay, so maybe I'm not sure that if that group is involved. I apologize, Rob.
Okay, no problem. And then one final one. Yesterday you talked about the online pre-registration form. I heard from some people that I know that work at offices saying their office signed up. What was the response like yesterday?
So I have to talk to my team that how many responses we have received. I don't have that number, but again, I want to take this opportunity to let everyone who is registering or pre-registering at this time to be patient with us, because we know that we still have very limited supply of the vaccine. We want to make sure that we are making it available for all these priority group, but also recognizing that it may take some time to get through the complete list, we are talking about thousands and thousands of workers, as well as close to 20,000 of the 80+ seniors. So it may take some time. We know that our vaccine supply at least is not increasing until mid of March. So until then, it will be slow, but please be patient and make sure that, we'll make sure that you'll get your turn and you'll get vaccinated as the vaccine supply permits.
Thank you.
Any additional questions from CTV?
Yes, could the shelter population cases prevent the region from moving into orange because it would be driving up our indicators? Or would that be taken into consideration that it's mainly in one sector?
Well, we'll have to have that conversation with the province to see. Right now, as we reported, even before we started to see more cases in the shelter population, we still had some background cases in the community between 20 and 30. So we'll have to take a look at that to see where we are, even outside of that particular cluster. And also recognizing that this particular cluster that we are talking about, it's not as homebound or restricted. Some of these individuals may be out and about in the city or in the county without necessarily isolating and the challenges of even identifying them as a close contacts, because nobody knows anybody. So there are some logistical challenges that we'll have to consider when we speak to the province in terms of the situation in Windsor-Essex. But as I indicated yesterday, so far we didn't had any of this discussion with the province whether we are being considered to move on to the next level or we're just staying as it is.
Okay, thank you.
Any additional questions from CBC?
No, thank you.
Thank you, everyone. Have a good day.
Thank you.